Hello students, today we'll start with the last topic of the unit 3rd, that is the principle of prescription writing and the medication order. So basically about the counseling we have read it in a previous lecture. So what is a prescription? Drug prescription, it is a written or verbal order for a medication by a licensed individual who can be a physician, dentist, veterinarian, etc., but be a registered medical practitioners. So if we see the history, the prescription have been used since ancient times. The Latin adopted as a standard language, that is RX, which is a prescription. SIG is a direction. So, the prescription of medication must be prepared by a registered medical practitioner, should be clearly written, typed, or computer generated, and be indelible and dated. If a drug replaces a previously prescribed drug, then the outdated one must be cancelled, signed, and dated. So, the information regarding the changes in the medication must be communicated to all who need to know, like the nursing staff, patient, pharmacist. So, the prescription for the medication in the hospital must include the following information: clear identification of the patient. So, the name, date of birth, registration number, address, number of doses or length of treatment, length of course either in days or number of tablets to be dispensed. So, there are different type of orders like stat, that is those that should be administered immediately, single dose one time medications, scheduled that is administered routinely until the order is cancelled by another doctor, PRN, or as needed basis, which can be said as SOS. Four common type of prescription is prescription in general practice, hospital prescription for inpatient, hospital prescription for a non-hospital pharmacy, and another is the private prescription. If we see the general drug information, it is been proprietary versus non-proprietary drugs, single versus compound drug, or the different doses of the drug. So the parts of the prescription contains a subscription, which is RX, also include the patient details. Inscriptions include the ingredients, quantity of each used. Subscription is the direction to the dispenser, directions to the patient, signature of the prescriber, and date of writing the prescriptions. So these are the parts of the prescription. Following information must be given on a prescription, which is most important, like the date, identification of the patient, formulation of the drug, like example it is a tablets, which has been written tab, capsule, it has been written cap, syrup, SYR, suspension, it has been written SUSP, for injection ING, meter dose inhaler as such is been written, and for the lotion as such. Rules for writing the quantity of the drugs, like the quantities of 1 gram or more should be written in grams. For example, write 2 grams, and the quantities less than 1 gram but more than 1 milligram should be written in the milligrams. For example, write 100 mg, not 0.1 gram. So the quantities which is less than 1 milligram should be written in micro or nanogram as appropriate. Do not abbreviate the micro or nanogram, since that can lead to prescribing error. For example, write 100 micrograms, not the 0.1 mg, not 100 mcg, nor 100 microgram. If a decimal point cannot be avoided for the values under the 1, write a 0 before it. For example, you can write 0.5 ml instead of 0.5 ml. Use the ml or m capital L for the milliliters. And for the liquid oral medicines, the dose should be stated as the number of milligrams in either 5 ml or 10 ml, since these are readily measured amounts, and special spoons are provided to the patients for the measurement. Next is for the some drugs, maximum dose may need to be stated, like the example is ergotamine in migraine and colchicine in the gout. So the maximum dose must be needed and is to be stated, like the ergotamine 1 mg at onset of attack and repeat every 30 minutes if necessary. Do not take more than 6 mg in one day or more than 12 mg in one week. So the indication should be mentioned for life threatening drugs. The next is the frequency of administration should be clearly indicated, like atenolol 100 mg once daily, amoxicillin 250 mg TDS. Accepted abbreviation may be used, but do not use is should be not accepted. Tell the patient what you mean these times a day or 4 times a day. What is the route and the method of administration should be clearly indicated by the pharmacist. Amount to be supplied, any cautions or the warnings should be written in the prescriptions. Model prescription require the name, date, age, sex, address, IPD number, what is the diagnosis of the patient, the subscription like the medicines what is being prescribed by the prescription of the medical practitioners. Take 2 tablets by mouth 3 times daily with breakfast, lunch and dinner. Take with food. These types of indication should be written. Next is the salutation of the doctor, like what is the background, what is the professional qualification of the doctor, from where he belongs to, phone number, registration number and register medical council number. These are some of the Latin abbreviations which is frequently used in the prescription writing. Look alike or sound like name, like case 1, Surzone, that is a nefazodine versus Seroquel, which is a quetiapine, which is the antipsychotics. These are the similar alike drugs which causes a medication order. So the similar overlapping strength like 100 mg and 200 mg, similar dosage form, that is tablet, same dosing interval BID, similar titration schedule, often stocked in close proximity on the pharmacy shelf. So, the prescribing and dispensing errors have led to a number of adverse events like nausea, vomiting, hallucinations, acute menstrual syndrome, lethargy, seizures, or it can cause death also. List of the dangerous drugs, abbreviations, acronyms and the symbols, like unit is mistaken as 0, 4 or cc, like you should write a whole unit, not only u. For international unit should be written as whole, not being written IU because it's interpreted as IV or 10. QD, QOD mistaken for each other period after Q, and O after Q can be mistaken for I. So write daily and every other day. Trailing 0 and lack of leading 0. Decimal point missed. Never write a 0 by itself after a decimal point, and always use a 0 before a decimal point, as been discussed earlier. In MS, MSO4, MgSO4, it is being confused for one another. Write morphine sulfate or magnesium sulfate. These are other abbreviations.